Hi, our group is Nellie, Mara, Iris, and Taryn, and we are going to be doing hyperventilation. Hyperventilation is whereby rapid, deep breathing occurs, thus eliminating more carbon dioxide than is provided. Iris is about to be seen for her cleaning. She has had a very scary experience last time, so she's been avoiding the dentist. She's had a stressful day and is getting a bit nervous in the waiting room.
Hey, Iris? Okay, so I'm gonna be cleaning your teeth today. So you can follow me. I'm gonna take you back. And then you can have a seat right here, okay? We're just gonna go over your medical history. Okay. So how are you today?
I'm really nervous.
Okay.
It's hot in here.
So here, I'll take a look at your medical history.
Can I hang on to it?
Uh-huh. Okay, so I see I see you're pregnant. Alright. No other changes in your medical history.
I'm just really nervous today, and I don't feel good.
Okay. Alright.
I think my baby's hungry.
Some of the risk factors for hyperventilation are women 30 to 40, pregnant women, high altitude, patients taking CNS stimulants, patients with aspirin toxicity, and patients with extreme anxiety, like Iris is showing.
Okay. Alright, so
I don't like the dentist. I had a bad experience last time. They put all these things in my mouth, and I don't like the sound.
Okay, so I'll just start off today by taking your vital signs then, okay?
Okay.
Alright, so I'm gonna check your pulse first. Okay. Okay, so your pulse was slightly elevated, having a rate of 85 beats per minute, where the normal ranges are 60 to 80 beats per minute. And then your breathing was also slightly elevated at 24 breaths per minute, which normally it ranges between 12 and 20. So since it's only slightly elevated, I'm gonna continue to monitor your vital signs throughout the procedure. It's still, we're still able to proceed with it. Does that sound okay to you?
Yes.
Okay. All right. Just take breaths. It's gonna be okay. All right. So, all right. Okay. So now I'm gonna move on to your blood pressure. Okay. Can I see your right hand? How far along are you?
70 weeks or 38 weeks.
Yeah. It's okay to be nervous. Usually that's normal with pregnant women. So, your blood pressure came out to 120/85, so it's not elevated too much, just slightly like all of your other vital signs. So that means we can begin with the procedure. Okay. All right, so
Some of the symptoms from hyperventilation are rapid, deep breathing, irregular breathing, fatigue, dizziness, extreme sweating, air hunger, which is also known as suffocating, trembling, and impaired coordination, balance, and problem solving.
okay. So I'm gonna go ahead and lean you back, okay? So what I'm gonna be doing first is I'm just gonna be doing some, it's probing. I'm just gonna okay, so we're just gonna be probing today. Okay, all right, so throughout this procedure, just make sure to notify me if you have any discomfort, okay? Okay.
No, stop. I can't do it. I can't breathe.
Okay? Are you okay?
No, I can't breathe. Can you set me up?
Okay, I'll do that.
I can't breathe.
It's okay, so I'm gonna have you put your hands together by your nose and I want you to breathe. Okay, breathe. So we're gonna count. Count with me. 1, 2, 3, 4, 5. Try to count with me, okay? It's gonna be okay. Okay. 1, 2.
When somebody is hyperventilating, you should have them put their hands over their mouth like this and breathe in and out with pursed lips, slow breathing into the cupped hands. You should also have them remove any tight clothing that could make them claustrophobic or feel like they can't breathe. What you should not do is have them use a paper bag or add any administered oxygen to the patient who's hyperventilating.
Okay, so I'm gonna okay. Okay. All right, so code blue, I'm gonna call code blue over here. Okay. Code blue, code blue.
Hey, this is Dr. Lu. What's going on?
So,
I'm just really nervous about my appointment, and I couldn't catch my breath, but I'm feeling better now because she told me, the hygienist told me to put my hands like this and to breathe in count, so I start to feel a lot better.
Okay.
yeah, so I took her vitals at the beginning of the appointment and they were slightly elevated, just like 5 over. I continued to monitor them throughout the appointment and everything was good until I laid her back to do the probing and she just began having a hyperventilation episode. I'm gonna make sure I document all of this into her patient chart. I don't think it's like best that we proceed with the appointment today just because she's not feeling well. It could be because I don't know. What do you think, doctor?
Okay. How are you feeling?
I'm feeling a lot better.
Okay, so it makes sense for this to happen because you're pregnant, okay? So I would suggest for you to go see your physician to see what's going on and maybe they can prescribe some medication for you. Or if you feel okay, we can wait a few more minutes and then we can proceed if you'd like.
I think I want to talk to my doctor to make sure it doesn't happen.
Okay,
again.
yes, I do recommend that for you, okay?
Okay, thank you.
If Iris's breathing had not improved, we would administer benzodiazepine, lorazepam, and diazepam 2 to 5 milligrams. And then if none of that helped, we would then call EMS.